This is Jerome Fryer, chiropractor. This is a model that I have created. It's a dynamic model with dynamic discs. As you can see, flexible. Just want to explain a few things through a chiropractic assessment and what I do to determine where the problem is. I often, first off, have patients lying on their tummy. This is the sacrum here. This is L5, L4, L3. What I'll do is I will assess by pushing down onto particular landmarks in the spine in different angles to feel the resistance. And also, I often ask for feedback on whether it's painful or not. So just to give you a little anatomical education here, this is, you can see a sacrum, as I described here, a sacrum, got L5, L4, L3. The important structures are the intervertebral discs in between, and we also have facet joints on the back side. Get one here, and correspondingly as we move up. So there are some areas that are of more common when it comes to pain generators. In particular, the facet joints are very often a pain generator, and the intervertebral discs. So when patients are lying on their tummy, it's very easily accessible to push in particular directions and understand the anatomy. So for example, if I push on the sacrum, S2 tubercle here, you can see how it stretches or opens this joint at L5, L5-1. So if someone reports to me that it's relieving, that relieves the pain, then it's a good idea from a therapeutic standpoint to create more space in this joint here. Very likely they're approximated or they're rubbing together causing the problems. So conversely, if I push on L5 and they say, oh no, that's kind of more sore, especially when I push over in this direction, you can see what that does is it actually pulls those pushes those vertebrae together and squishes that joint. So, but at the same time, when I push here, you can see what it does is it opens the joint above it. Okay, so it could be relieving as well. So whether there's pain or not, and whether it's relieving, gives me some therapeutic clues on what needs to happen. So one of the techniques I use once I identify where the pain generators are, whether it's the disc or the facet joints, I'll render flexion distraction, which is a technique to open those facet joints. You can see that. Sometimes I'll use manipulation, in which patients are lying on their side, and I'll render a force, specific force, to gap open that joint, and you can see that there. All right, and we do it on the other side as well. You can hear that. Also, what that does is it separates the two articulating surfaces and creates more joint space width in the facet joint. So now there's more space between the L5 and the S1, for example, often bringing patients relief. And the strategy I do is I flip them over on their back and I do extension distraction, which is done this way. You can see it creates a low pressure within the disc and increases the fluid flow into the disc, creating more height, because ultimately It's the disc that governs the spacing of this facet joint. So you can see as the disc loses height, the facets slide. See that? They slide together. This is one of the common causes of arthritis in the spine, is when the disc loses its height and approximates those joints, and they rub and then create little bony spurs. So thank you for listening. I hope you learned a few things.